Good day. My name is Margaret Lim, and today I'm going to perform perineal care of my patient. So, what is perineal care? Perineal care, also known as perineal genital care, which it is an aseptic cleansing of the vulva and perineal area to reduce the risk of infection. So, the indications of this perineal care, this is done for the patient who are in bedridden and postpartum and clients who come out of the surgery, and also the clients who are indwelling catheter. Its purpose are to provide comfort to the patient and to prevent and minimize the risk of infection and to cleanse the genitalia and to enhance and promote the healing of after vaginal surgery, and lastly to observe the condition of the postpartum patient. So next is I will assess the patient to determine the need for assistance of the perineal care before, during, and after the procedure, including if there is any presence of irritation, inflammation, excessive discharge or odor, and swelling, and also to assess the patient that ability to do self-care. So next is I have gathered all the needed equipments. So first we have pair of clean and sterile gloves. And next is I have bedpan with cover and paper lining. Here we have a forceps and sterile for working forceps with paper, wrap paper, covered with wrap paper. And I have soap suds solution. Here I have towel, rubber sheet, and blanket for draping the patient later on. And then I have washcloths and betadine with cotton balls, a pitcher of water, dry cotton balls, kidney basin with paper lining, and I have perineal care sterile pack. So now let's proceed to the procedure process. So first thing we do is we check the doctor's order, and then we apply hand hygiene and wear clean gloves. Since we're going to do the perineal care, cleaning of perineal care first, then later on we proceed to the aseptic technique of perineal care. Since we already assembled the needed equipment, next is we're going to identify the patient and explain the procedure and get her consent. Good morning, ma'am. My name is Margaret Lim, your nurse assistant. Can I ask for your complete name? Okay, ma'am. Thank you. So today I'm going to do a perineal care, which means that I will be cleansing your external genitalia and anal area for you to feel comfortable and refreshed. Would that be okay, ma'am? Okay, thank you. So next step is we're going to make sure to provide privacy and let the patient remove her underwear and napkin. So next is we're going to position my patient in bed by assisting the patient in a dorsal recumbent position. So next step is we're going to put a rubber sheet under the patient. Next is we're going to drip patient diagonal properly. So next step is we're going to put the bedpan under the patient's buttocks. So next is let the patient void in the bedpan, and then after that flush the vulva with water to remove blood stains including grain. Excuse me ma'am, ako magbubuan ng water in and then dry the vulva using the cotton balls. Dry using the dry cotton balls. Next is we're going to clean the perineal area using the soap sud solution. So start so starting from mons pubis to down to perineum and anus. The next is we're going to the farther labia minora, near labia minora, and then next is farther labia majora, and then near labia majora, and then back to mons pubis down to perineum and anus. Farther labia majora. And then after that, we're going to rinse the soap suds solution. Excuse me, mahal ako sa buko. And then after that, we're going to dry with using the dry cotton balls, and then with the same direction. Mons pubis down to perineum, then anus. Farther labia minora. Farther labia near labia minora. Near labia majora. Since we're done cleaning the perineal area, next is we're going to proceed the aseptic technique of perineal care. Here I have already placed the towel, and also I also opened the sterile perineal pack. So next is I'm going to use the forceps to open the sterile forceps that I have wrapped it with paper, and place it here, and then I'm going to also put the betadine cotton balls. Next is I already apply hand hygiene and wear my sterile gloves, and also I have here the sterile perineal pack and also the betadine cotton balls including the sterile working forceps. Next is we're going to cleanse again the perineal area of my patient using the betadine cotton balls in a aseptic technique. So we're going to do it in the same direction. Excuse me, ma'am. I'm going to. First is the mons pubis down to perineum and then to anus. Next is we're going to next is farther labia minora, near labia minora, farther labia majora. Near labia majora. Next is back to mons pubis down to perineum and then anus. We are done. We're going to remove the bedpan. And next, we're going to discard the draping of my patient and then assess the patient's anus using the washcloth. Next is I let the patient put on sanitary napkin and underwear and then assist the patient to arrange linens and make patient feel comfortable. Excuse me, mama, makatlan ko, ha? Since I am done with the aseptic technique perineal care, I do aftercare of my equipments and I have already removed the gloves, apply hand hygiene and lastly I'm going to do the charting. That's all. Thank you.